am presenting on maternal mortality, proteinuria, and pregnancy-induced hypertension as a case study of one of our regional hospitals in the Brong region of Ghana. It is a well-known fact that maternal mortality is an international health issue, and therefore we have been conventionally dealing with the situation like the medical causes of maternal mortality and medical causes of maternal mortality, which are well known, about 6 or 7 factors. However, when we studied the maternal mortality pattern in the Brong Regional Hospital in Sunyani in Ghana, we found out that day in, day out, one of the major causes, that's eclampsia, which can come in the form of proteinuria, was dominating the course over 3-5 years. And therefore, we wanted to look at how we will be able to manage this situation to bring down maternal mortality. So what happened was that we studied the maternal mortality pattern in the hospital and did a survey among the women attending antenatal care, and then we did some focus group discussion, and it came out with the conclusion as to what is the major cause of maternal mortality, what is the attitude, what can we do to improve policy decision making to improve maternal mortality issues in the hospital. For 3 years, for the consecutive 5 years, as I said, starting from 2010, the total maternal mortality in the hospital was in a range of 139, the entire was 139, made up of 2010, 20, then 2011, 35, then it repeated itself 35 in 2012. 2013, we were able to bring it down to 18. However, it was still high enough for the country to worry about. And 2014 further brought it down to 14. But unfortunately, in 2015, it went up by a margin of 3. And when we looked at this, we were not happy with it. So we said, let us find out what is the major leading cause of it, and then how do we, as seen by the table on the other side, as compared to the total number of antenatal attendants over the years, as we have shown on the slide. So what? Everybody knows that in the sub-Saharan Africa, a number of countries have their levels of maternal mortality since 1990, and that is attributable to myself and the group that worked around the same topic in 2015. In other regions, including Asia and North Africa, even greater headways have been made. However, between 1990 and 2013, the global maternal mortality ratio, that is the number of maternal deaths per 100,000 live births, had declined by only 2.6% per year. This is far from the annual decline of 5.5 required to have achieved the maternal Millennium Development Goal 5, as according to Tahiri and Co. And it is an undeniable fact that one of the leading causes of maternal mortality, in Africa is pregnancy-induced hypertension leading to eclampsia, or whichever comes first and is detected. So it's at the background of this that we started to do the study. How do we do? The study area, as I said earlier, the study was conducted in Brong Regional Hospital in Sunyani. In this study, protein in the urine and blood pressure of some 440 pregnant women who visited the hospital between January to December 2015 were monitored. Retrospective data based on the maternal deaths from January 2010 and December 2015 were also retrieved and analyzed. This was augmented by interviewing about 150 respondents, made up 75 each from the antenatal and postnatal section of the hospital, based on the maternal health history, knowledge on and their knowledge on pregnancy-induced hypertension. As a result of this, the study, with respect to the proteinuria and blood pressure, monitoring showed that 36 of these mothers had traces of protein in their urine, while 32 mothers out of the 450 had elevated systolic and diastolic blood pressure, which we have been ignoring clinically. So a midwife measures BP and doesn't speak anything, and before you are aware, the woman starts twitching. And then proteinuria, we will do the steps all right, check for your protein in urine. Unfortunately, we're not paying much attention to that due to poor staff attitude. The study also revealed that when data on maternal mortality and PIH of pregnant mothers were retrieved, that a total of 75, that is out of 75,439 mothers attended the antenatal session of our hospital, which is a good figure enough to make any deductions out of. Out of this, 139 of them, as I said, died out of PIH in the years that we gathered. The result of the study have shown that maternal mortality among ANC mothers visiting the hospital is generally high. This could be as a result of elevated systolic and diastolic blood pressure, in addition to high levels of traces of amount of protein in the urine of pregnant women visiting the ANC section of the hospital. It has been earlier reported that risk factor for preeclampsia has included medical conditions with potential to cause microvascular disease, e.g. diabetes, mellitus, and then chronic hypertension, vascular and connective tissue disorder, anti-phospholipids, antibody syndromes, and nephropathy. So the future step is to therefore recommend that education needs to be intensified to enlighten pregnant women about risk factors of pregnancy-induced hypertension, and possible eclampsia. This could trigger a change in the behavior pattern to control the rate of maternal death due to eclampsia. And then the development of clinical guidelines and policies for the management of preeclampsia and pregnancy-induced hypertension and the related maternal mortality, especially for the health workers who most of the time would have ignored such findings in their clinical checks. So that is the way I intended to present because of the lack of time. But any